Hello, listeners. A warm welcome to Views on Health. A great pleasure to have with me on the program today Professor Pujitha Wickremasinghe, Professor of Pediatrics, Faculty of Medicine, University of Colombo, and consultant pediatrician, Lady Ridgeway Hospital, the premier children's hospital in Sri Lanka. A warm welcome to our studios after quite a while, Professor, and it's a pleasure to have you with us.
Thank you.
For the information of our listeners, the topic under discussion on the program is accidental injuries at home. Something that I think every home that has a baby has experienced at some point in time. Babies tend to fall from beds, from cots, from wherever, from within their playpens, anywhere within the house. And there are times that they've hit their head and they may have hurt a limb. Worst case scenario, they could have hurt their spine, and it goes on. So, having said that, by way of an introduction, may I invite you, Professor, to tell us about accidental injuries that take place at home.
Yes, actually when you take accidental injuries, it's a broad category of injuries that we could see. And out of that, the majority would be falls, which there would be simple falls where they would sort of bump a part of the body and there can be a simple bleed into the. So this is some of the most worrying thing that a parent would see and experience in their when they're bringing up a child. And of course, I don't think a single child would go past without having a single fall. So that is so common. But on the other hand, all those injuries are not really very grave. But however, we will not be able to easily understand which one would need quick medical attention, which one we can observe at home, which will just pass by. So I think giving an overview about these injuries, most of the time they would bump their head because when they fall, they are not in a position to protect their heads. Although several mechanisms are there naturally, they develop, but still they will bump most of their heads. And whenever a bump is noted by the parents, it is naturally alarming, and most of the time parents think that there could be something happening inside the brain or the skull. So actually majority of these, the bumps are actually a small bleed which happens underneath the skin. So whenever this type of a injury happens, the immediate home remedy or the first aid should be to provide the cover with that place with a pack of ice, which will help to ease out the pain as well as the bleed will stop. And then of course afterwards you can observe. Now whenever this fall happens, the most important thing is to see whether the level of consciousness. If the child is concussed, he loses temporarily the the consciousness, then of course it is an alarming thing where you should better rush the patient to the hospital. But having said that, you also have to be careful when you are taking a child to the hospital. You should not be hastily taking the child. You should carry the baby very carefully because of that type of magnitude injury could also cause some form of injuries to the spine, especially around the neck. So even if you are lifting, it's very important that the neck is well supported. You can roll 2 small towels, keep by the side of the neck and tie it with a small piece of cloth, and then if possible to keep on a plank of wood or something like that and take them to the vehicle and make them lie in. If there is any doubt, it's always best would be to get down an ambulance because today's context which is fairly easily accessible. Because sometimes what happens is more than the fall, the handling causes much more bad injuries afterwards. So if not so, of course, then you can observe, and with time, of course, you will see if the child is very drowsy or if the child begins to vomit, and especially if there is bleeding from the nose or the ears, then of course that is again should be considered as an alarming sign. At least the child may need not to be admitted to hospital, but of course should be brought under the supervision of a medical personnel and then do the basic examinations and see whether there are any other warning examination findings. So those are the main things. Now what happens sometimes is the child may fall, the child is otherwise perfect, but sometimes over-enthusiastic feeding and all may prompt the child to vomit, and then that could be taken as part of the fall. So we have to make sure that we should not do any unnecessary handling as well as unnecessary attending. Just let the child be normal and observe the child, what happens to his behavior, whether there would be any nose, throat or ear bleeding, as well as any changes in the behavior as well as vomiting. So those are the main things that we have to. Now then the next thing is, if after some simple fall, sometimes parents keep them without bathing for a long period of time. The whole rationale behind non-bathing is, if there is a small hematoma underneath the skin, water invariably, because the skin is not a perfect waterproof layer, there are small crevices. Through that the water can seep in and that can take germs inside, and then the hematoma can get easily infected. It can turn into an abscess and cause a lot of problems. So because of that, that's why we tell not to bathe, but that is also for about 48 to 72 hours maximum, and that is for a bleed where there is a big bump, where there is a significant bleed underneath the skin. But of course we see that children fall very, very frequently, and most of their falls from their own height when they begin to walk is not very significant. And I know many parents don't keep their children on the floor thinking that the child may fall and injure. But of course that type of a fall, always they will be able to put their hands in front and balance themselves, or even if they fall, it is mainly after a little bit of the force will be less. So, but of course letting them to walk will give them much more opportunities to learn, to balance themselves, to walk, and gain other controls of the musculature as well as the body structure. So don't discourage them walking, but allow them to be. But of course make sure that the surrounding environment is not filled with furniture or any other material that would tend them to fall, trip and fall, and sometimes make any cut injuries also. So the environment should be made clear for them and make sure that it is not slippery. And sometimes of course to overprotecting, they sometimes keep mattresses or some form of a foam layer for them to walk. But of course, especially a child who begins to walk, that is not a very good thing to do, because they will not be able to get the force properly, and they try to work against the sponge, and that will hinder their movements, as well as that can cause certain injuries as well as malalignment, especially for the knee and the ankle joint. So they should not be scared to leave the child on the floor, but of course make sure, as I said, there should not be sharp toys or edge toys around them, where even if they trip and fall, they would get a bad injury. So that way we can look into them and see how we can work on these injuries as well as. So the prevention as well as is always good. But of course, having said that, a child who is just trying to walk or who is trying to get balance will not be fall proof or will not have no falls. So you have to make an allowance, but of course you have to keep the environment as protected as much as possible.
Thank you, Professor, for that detailed and lucid explanation. A question about observation. Now, how does a mother, father, whoever adults around the baby ascertain how long to keep how long to observe? Because first thing is panic, we have to take the child to the doctor. Fair enough. Then if that happens, the doctor will obviously examine the child and say, okay, this is it or this is not it, and then you deal with it accordingly. But as you say, on the other hand, one can observe. But then for how long? And you did say about signs about vomiting, or there may be underlying bleeding or bleeding from the nose or the ear. Then of course definitely the child has to be taken to the doctor immediately, as soon as possible. But otherwise, if there's no bleeding, and there could be a lump or a bump somewhere, depending where the child has gone and hit himself or herself. Because sometimes if they fall off beds, they fall off cots, and the floor is, unless it is carpeted, not everywhere that is carpeted, so you get the normal flow, be it tiled or otherwise. It's a hard surface that the child falls onto. So observation, what would you advise?
Yeah, observation, that's why I said if the child's behavior seems to be quite okay, and if the normal, the orientation, the behavior that the child was having so far, if that is maintained to a great extent, then of course you can observe for about 24 hours at home. But if there is vomiting, or if there is any change, any doubt about his behavior, he is not really oriented, he is talking something which he did not usually did in the past, that type of a thing is happening, of course then it is better to take medical advice as soon as possible. Then of course, especially if there is a nose bleed, throat bleed, ear bleed, that type of bleed, obvious bleed, because a bump is also a bleed, but of course it just stops there and that is naturally expected. But a ear, nose, throat bleed indicates that there could be something has happened with inside the skull. So then of course it needs some observation much more. That does not mean that there will be immediately open up or a CT scan done or anything. But of course within the hospital, if there is observed, then they can immediately attend to the child if there are any warning signs are popping up. So that's why. So the important thing is keep the child at home, see over a 24-hour period what happens. If there is any change in the behavior, any vomiting occurs, any changes in their musculature or ENT bleeds, then of course take action for that.
Professor, having heard your explanation, if a child is big enough, meaning like 1 plus or nearly 2, and they're beginning to speak, the child can always express and say a pain here or pain there. But a child that cannot talk, younger child, few months, a year, a little over a year, obviously cannot say where it's hurting. And then the physical sign like a lump or a bump. So in that situation, doctor, obviously I would, from a lay perspective, irrespective of the period of observation, would you say that it would be better to still see a doctor even the next day and just clear it up?
Yeah, I think a child under 1 year, of course, yes. Under 1 year, and especially based on the impact of the fall. Now, if the child had sort of popped out of the cot and had fallen 2-3 feet from a height of that nature, then of course if there is any doubt, always it's better to take to the hospital. They should not be having a false sense of security, because it all depends. Sometimes a 1 foot height of fall from 1 foot would be much more damaging. Sometimes they are falling from 3 feet high elevation. So it's always important that they get that important. I mean, that's why it is very important that you see how the child's behavior. When the child is being handled, if there is undue cry, if the child is in some form of discomfort, then of course definitely. And as a rule of thumb, I think children under 1 year, it is no harm actually showing to your family doctor and getting a feedback about what things, or whether there is any abnormality, then of course taking on from there. So it's very, very important that you take and have a look, get a medical opinion on this area. But again, of course, from the preventive aspects, whenever a child should be always kept in a much more safer area, and especially if the child is kept in the bed, and if they happen to use a mosquito net or something like that, it is always better to tuck and keep the child on that. And sometimes people think, I have just kept the child for a few seconds, but the few seconds could be very, very disastrous. On the other hand, the child has never turned around or rolled over before, but there is always the first day, and you never know when the first day is. So it's always secure that you place the child on the floor on a mat rather than keeping unattended on a bed or a cot. So those type of things would be help to sort of prevent also such injuries.
Doctor, in some cases, in rare cases I would think, please correct me if I'm wrong, there could be other type of injuries like a cut or sometimes even a minor burn. Could you please advise us on that?
Yes, cut injuries, of course, is again mostly from maybe toys or any other furniture or something like that. So what happens is most of the time they would begin to bleed, and it's very important that you try to stop the bleed. But when you put a tourniquet, you can tie it proximally close to the trunk area of that area and try to stop the bleed. But more than that, I think keeping tight pressure on the wound would be helpful. But if it is just only a minor superficial cut, of course, then they can apply a little bit of antibiotic cream at home and keep them. But if they see a deep injury, deep cut, then of course it's always better to get to the hospital and see, because sometimes there can be other injuries inside, where especially tendon injuries, muscle injuries, which if they are not properly sutured, then the long lasting effects will be there. So on that way, I think it is important that you attend to those injuries that way. Then the other main thing is the burns, and commonly they would occur with either hot water burns or either a warm food item, something like the prepared food item may be toppled onto their bodies. So the most immediate and the most important first aid is just to keep them exposed to flowing water. Just take them under the shower and open, and try to keep them let the whole area be soaked with water. Then of course that will take away the burn injury to a great extent. Then of course you will always see that there will be a blister appearing in that area. So one should never break the blister. They should never puncture the blister. Just leave the blister there. And then once you have attended to the first aid, at least 15-20 minutes, maybe even more than that if the burn is extensive, kept under running water, then of course definitely you should take them to the hospital, because depending on the injury and then the extensiveness of the nature of the injury, it's very important that the medical care is given to the child, because otherwise there can be extensive scars or there can be infections which can cause a lot of harm, and they can even develop other complications like septicemia, kidney failure, that type of thing. So for burn injuries, of course, if it is fair amount of burn which will cover more than the palm size of the palm of the child, if you just take that simple, because that amounts to about close to about 5% of the body, that importantly needs medical attention, and then do the needful from that point of view.
At which point in time would you as a pediatrician say that the child needs to be hospitalized after a fall? What would make you say that? What is the extent of the injury that has happened? I'm not saying it's a common thing, but if it does happen, you would decide, the child needs to be in hospital and under professional medical care.
If the child's behavior has changed, if the child is talking differently, he or she prefers to sleep for long hours, more than that, and then there can be a transient loss of consciousness. Then if the child begins to the child begins to vomit, or if the child develops any bleeds from the ear or their nose, then of course definitely they will need professional observation at least for about 24 hours, and then based on that decide whether further investigations, evaluations are needed. So I think those are some of the most important things, that you should take the child to the hospital and then kept admitted at least for about 24 hours, and then once everything has settled, then they would be released. So basically change in the level of consciousness, vomiting, then bleeds from the nose or ears would warrant admission and observation.
Professor, in your wide practice, would you have come across instances where the child has actually broken a limb? It could be rare, but that also can happen, especially when they fall off the bed or the cot, which is a higher surface. From the floor, even they're trying to stand, balance, and they fall, as you explained, they'll be able to in some way, without knowing, even protect themselves by their hands sort of coming forward to break the force of the fall. But in other instances, has there been at any point in time where, unfortunately, a baby has had a broken limb?
Yeah, there are several instances. I mean, we have seen a fair amount of children who just fall within the household. Most of the actually children under 1 year or 1.5 years, we do not see that much of broken limbs following falls. There could be some other form of non-accidental injuries could be the cause for that. So that's a different topic. Then, of course, older children, of course, we do see them after they walk, because once they gain the ability of running, then, of course, it's fairly inevitable for them to prevent from getting a fall. And then based on the place where they behave, I mean, it may be the garden, they are exposed, or maybe coming down the stairs or whatever, then, of course, they have the tendency, and we do see fair amount of children who are coming with broken limbs. On the other hand, I must say, now parents have a big scare that when the child falls, that they would break the skull. Of course, the skull is very resilient, and then the material inside the skull will also does not get damaged very much in a small child. Of course, in the older age, with the brain getting atrophic and all, you can have a difference. So the same cannot be attributed to a child. So because parents think that a child has fallen, of course there can be a bleed inside the skull and we have to do something. So I just wanted to enlighten parents that although even if a child has fallen, and even sometimes we may do a CT scan, if we see a small rim of blood inside the skull, still if the baby is perfectly normal, then we don't do anything because it will get absorbed. And sometimes parents come and ask, why don't we do an X-ray? Yes, we can do an X-ray and we can just spot, okay, there can be a small hairline fracture, there can be a small skull fracture. But of course, beyond that point, we don't do anything. So sometimes knowing that, we'll know that, okay, that's there. But of course, beyond that, we don't do any medical interventions for that. So some of these investigations are not really necessary because X-rays, CT scans, again, mean a lot of radiation that also could be harmful much more than the fall the child incurred. So these are some other things. And actually, I wanted to highlight one other point. Sometimes parents use walkers. The walker is actually an instrument actually should never be used by a parent, because it is not going to help aid the child to walk at all, because there are wheels and child will be pedaling, he will not be walking. So his feet also get malaligned, and then of course they are fitted with wheels, so they can go on the surfaces, and most of the houses are now tiled or polished cement, so they can go and knock somewhere, they can topple. And we have seen so many children falling off these and getting pretty bad injuries. So my main advice on prevention of injuries as well as for the bone health and limb health, do not use a walker, because that does not give any advantage to the child in the short or the long run.
Thank you for bringing that point up, Professor. In fact, we do see these walkers in many homes, and not that only parents buy them, there are family and loved ones who present children with, a whole gamut of childhood sort of, I would say, I don't know if they call it an appliance or what, but that are used for children, and obviously then they're put into that. And from a lay perspective, we consider it safe,
Yeah.
Whereas medically you say no, it cannot be safe for a child. So that is a good point that you explained to our listeners. Thank you very much for that. So Professor, time is catching up with us. What would be your take-home message?
So the main message is, if a child falls, don't panic. Just calmly attend to the child, because sometimes panic can cause much more worsening of the injury than the child really sustained during the fall. So just let the child there, assess the child, and make sure, especially if the child can sit up on its own, just encourage the child to sit, because that means there are least amount of injuries. But if the child shows any resistance to movement, then just keep there. try to get professional help if possible. And as I said, support the head and take care carefully to the medical vicinity. And when observe for the warning points like vomiting, change of level of consciousness, as well as bleeds from the ear or the nose. And then if those things are happening, then seek medical attention as soon as possible.
Thank you so much, Professor. On that note, we end this interesting discussion on accidental injuries at home. We place on record our grateful thanks to Professor Pujitha Wickremasinghe, Professor of Pediatrics, Faculty of Medicine, University of Colombo, and Consultant Pediatrician, Lady Ridgeway Hospital, Colombo, the premier children's hospital in Sri Lanka. Thank you so much, Professor, for being with us in the midst of a busy schedule.
Thank you. It's a pleasure.
My thanks also go to Damayanti Kolombage for technical assistance. I'm Fatima Razi Carter saying good night and looking forward to your company next Monday, same time on Views on Health.